So in epilepsy, the second type is Pittmal epilepsy. What is that? Pittit mal Pittmal epilepsy. Okay. What will happen? First is the known of Pittmal epilepsy is unknown. The cause. The cause is unknown. First, mostly it appears in anger. Most of the anger, young people or young persons. Okay. Second thing is that you have to remember. Third is that, and it is rare, not common. It is rare. Okay. And if it started, it will not end. It have multiple times. Okay. Multiple times the patient have epileptic attacks. Okay. What are the clinical appearance? How is different from other uh, epileptic attacks? Let's discuss that. First is the patient have loss of conscious. LOC will call loss of consciousness. So maybe sometimes the involvement of spasm or clonic attacks or tonic attacks will be seen. So sometimes clonic attack or clonic attack all are seen. Okay. And the patient are jerking movements, strong jerking movements with LOC, clonic or tonic. Yesterday I told about these things. And along with that, the patient are jerking, very continuously jerking movements. It will, he will able to jump like that jerking, very strong jerking movements. But they are continuously, okay. And along with that, the eyelid, if you see their eyelids, it will blink like continuously. Okay. And this attacks will frequently one another after one another. It will come continuously. This is the thing we have to understood. Okay. But it is mostly seen or rarely seen. Okay. And it is seen in younger persons. Already I told you. And it will come if it comes, it will come multiple times, hundreds of times. Okay. If you go to the doctor, so from the period of starting to the till arrival of doctor, till the medicine started injected or given by the doctor, till that the patient have multiple episodes. Okay. In that you can see LOC, tonic clonic movements or jerks, mostly eyelid jerks. You can see that. And so this is the thing you have to understand. So this is petit mal epilepsy. After that, the petit mal epilepsy, we have temporal lobe epilepsy. Temporal or psychomotor or psychomotor epilepsy. This is the thing you have to understand. Psychomotor epilepsy appears during any age. So it is common in any age. First thing we have to understand. Second is the duration of attack is longer than petit mal epilepsy. Patient behaves as though he was partially in consciousness. So what will happen? Patient behaves like uh, he is in conscious level, but he is not in conscious level. Okay, and sometimes he will remove his clothes and he will pass the urination. So this is the psycho motor epilepsy. He behaves like he is conscious. Okay, he will remove his clothes. behave like conscious. Okay. And what are the other things? Violent aggression, violent behavior, violent behavior. And the other thing, he have urination, will pass urination while this epileptic attack. And if you want to talk with him, he will give irrelevant answers. If you ask what your name, he will not answer. He will answer something. Where are you? Now where are you? After the epileptic attacks, also he is irrelevant. I saw a number of patients like that. Okay, irrelevant. If you ask questions, he will answer irrelevant answers. Okay, patient goes into deep sleep. Okay, after that he will sleep in deep sleep. He will have snoring from mouth also. He will snoring sounds and deep sleep. We'll go deep sleep for number of times, number of hours. Sorry, deep sleep. So is this is called, you can tell that this is temporal or psychomotor epilepsy. Urination, if it occurs in any age, behavior changes, consciousness, behave like he is a conscious person. Violent behavior will remove the clothes, irrelevant answers, and he will go after the epileptic attack, deep sleep. So these are the things you have to remember about psychomotor epilepsy. Next, other type of epilepsy is Jacksonian epilepsy. What will happen in Jacksonian epilepsy? In these types of epilepsy, spasm appears at one portion of body and within a short period migrate to another portion. Attack usually begins from great toe, okay, from leg and index finger, or from angle of mouth with weakness in one arm or leg attack, followed by convulsion. The convulsive seizure may last for few hours or even for a day. So it will start from the one part of the body. Not it will start directly. It will start from the legs and will go to the hands, and it will having the patient weakness of uh, mouth. Okay, all this you can see. So in Jacksonian epilepsy, what will happen? You can start with the toe. Okay, toe of index, great toe first, and it will go to the index finger. Okay, and other portion gradually. Okay, and one arm, one leg weakness, upper limb and lower limb weakness. Okay, and the patient have convulsions. It will start entire body. So this type of periods, or this type of gradual development, what we will call Jacksonian epilepsy. Next is very important. Most of the people suffer from this type of epilepsy. That is focal epilepsy. One is grand mal epilepsy and focal epilepsy. These are the most common. Okay. Focal epilepsy. In this condition, focal seizures occurs in any part of the body and it remains localized in the condition. Usually, one or both extremities are involved with involvement of one side of face. In that, what will happen? Only brain, one part of the brain is affected. So, where the brain part is affected, so symptoms will appear in the body. Okay, like frontal part will have, okay, frontal region in the upper side, right side mostly. So, mostly what will happen? The opposite side of leg and hand will having convulsions, and along with that facial effect is also seen. Okay, so all the things are same, but one part of the brain is affected. So that is the reason we'll call focal epilepsy. Grand mal epilepsy is the most common. In 100 patients we will get 90, 70, 80, 90%. grand mal epilepsy. Focal epilepsy, other 10, 20 to 30%. Other is like pet mal, psychomotor, and Jacksonian epilepsy is the 10 to 15%. Okay, so these are the epileptical types. Okay, we have to understand about that which type patient having and how many we have to give the counseling to the patient. Okay, we have to diagnose that, and after that we have to treat the patient. Diagnosis, what are the diagnosis? With the help of history. This is the modern medicine diagnosis. Okay, what we will do, we'll do history of patient first, and first next is EEG, electroencephalogram. EEG will do, and some type of blood sugar levels. Okay, blood sugar levels and calcium levels, thyroid, calcium, all examination to be done because there is some reason behind. Some sometimes blood sugar levels, low blood sugar levels also cause hypoglycemic attack. We will call hypocalcemic attack. Okay, sometimes we need MRI brain to determine there is any tumor on a cyst, on a scar, any injury. So we'll know about the internal condition of the brain. Okay, so this is how modern medicine doctors will diagnose. And our part is we will also need some, if we want to know the tumor cyst, so we will also need MRI because without the MRI brain, you cannot know where the tumor is and what type of tumor is that in the brain. So definitely we need MRI brain, and if the and also need sugar, calcium levels. Okay, sugar levels and calcium levels because these are the very important to diagnose which type of epilepsy. Along with that, we'll do pulse diagnosis. In that, mostly the brain is utilizing part of blood. Blood. So what the brain does, the brain will utilize blood. Okay. So blood utilizing part of the brain is affected. So there's the reason there is a chances of epilepsy. So we have to give brain remedy to improve the circulation, to improve the purifying agent, and to improve the overall function of the brain. Okay. So if there is any issue regarding brain structural issue like tumor, cyst, anything, so you have to treat like that. So it is purely depend upon the diagnosis. But basic treatment we will do after basic treatment we can assume that utilizing part of the brain is not utilizing blood, so there's the reason they are the reason behind the epilepsy. But after doing radiological diagnosis like MRI, EEG, blood reports, you have to tally, then you have to go through with that things. Okay, some patients will have not epilepsy but there are symptoms like epilepsy in the hysteria like, and there are false epileptic attacks also, pseudo seizures, what we will call pseudo seizures. They are due to the anxiety, fear, depression also. In the hysteria, due to the depression, and we have pseudo seizures. They are not any issues in the body, but due to the anxiety, depression, due to the fear, the patient will develop these symptoms, symptomatic seizures, what we will call symptomatic seizures. And in syncope also loss of consciousness, in that person also having will have symptoms of epileptic attacks. So we have to see, because of, by taking proper history, we'll know about this. Is taking the patient is having any type of depression, anxiety, fear, everything you will know about after that taking history only. Okay. So this is the thing we have to understood about epilepsy. Now come to the treatment part. Okay, I already told you that we have to improve the circulation to the brain, proper nourishment to the brain, proper oxygen level to the brain. Okay, and mostly we have metabolic remedies we will select in these cases. So first we will give S5. Okay, because S5 is the first metabolic remedy. If the patient having much much improvement in his symptoms, you can go through that remedy. If not, you can add S10. Okay, then again A3. A3, you know that it is a nutritional remedy, and along with that BE, because blood, where the blood is there, you have to add BE. Easily you can know that. And along with this is the metabolism of entire body, with metabolism will improve, but mainly focused on brain. Along with that, we have systematic remedies. We know that F1, nervous system, CNS, work on CNS, along with F1WE, where the power of F1 will increase. Okay. For massage, because they are the, you will not apply YE because of the extra stimulation of electricity. So you have to apply YE on the spinal cord, because through the brain, through the spinal cord itself, the stimulation are coming to the body. Okay, so that's the reason we're applying YE to calm the spinal cord during the attacks. So we'll advise YE on whole spine, or you can add WE also, whole spine. And along with that, already I told you that something required. Sometimes what happen, the due to the abdominal issues also, due to the worms in the intestine, or gastric disturbance, which lead to anxiety, fear, depression also. We need to check the digestive system also. If the digestive system is not good, you have to advise to improve the digestive system with S10, C10W. Okay. And advise, ask about constipation. Anything is there, you have to add these two remedies, C15 S last with S10, C10 WE. So F1 WE, S5 A3B initially, or else one medicine S5 A3B and another remedy S10 L1 WE. You can give three types. Both are metabolic remedies. This first medical metabolic remedy, second metabolic remedy is S10. Okay. So this is the thing you have to remember while treating the epilepsy. This is the basic treatment. Okay. It is not the complete treatment. Based upon the history and after doing, if you have regular attacks after giving this remedies also, then you have to go to through with ECG, blood reports, and MRI sometimes. Okay, not everyone need MRI, but some people need MRI. So you have to check the MRI and where the issues are there. Okay. Uh, I saw one patient. He he have epileptic attacks for every 15 days. So he went to doctor. He had CT scan, MRI brain, everything, EEG, everything is normal. After taking proper history by the doctor, so he told that I have fear and anxiety issue. So it is coming from past 10 years, but now I am unable to control the fear and anxiety level or depression level. So whenever I am overthinking, I am getting those issues. So these are the symptomatic seizures, not a seizure. Okay, so doctor advice, don't take stress, do exercise, do walking daily, regular walking, eat healthy food, okay, and do uh, breathing exercise to stop, do medication, okay, and they have advice for taking water quantity to increase water quantity. So all this diet advice, and along with he gave one simple medicine, but for anxiety. So after taking, he is not he stopped taking anxiety medicine. Only he is focused on natural things, walking, exercise, a daily intake of water increased, proper sleep, decrease the level of anger issues, fear, depression, anything, anxiety. So take care of doing regular breathing exercise, relaxation techniques to reduce the fear, anxiety. So these are the things he did. So after doing regular, he the scissors are stopped. He never have any type of scissors. Okay. So this is the history. Will tells you about what is the condition of the patient and what treatment he needed. But it is the initial treatment. You can go through this treatment, but you have to know the cause. Okay. So this is all about the epilepsy. So we will discuss tomorrow very important topic. Please join earlier as much as possible. Okay. So in the CNS, this is very important topic. We'll call as in the normal language paralysis. But without with the paralysis, what is the main cause is cerebrovascular accident. Okay, this is the thing you have to understood. Okay, so tomorrow we'll discuss in detail about cerebrovascular accident. So any doubt, kindly ask.